groups, I would recommend that you look up tables that shows the different functional group you have in the pharmaceutical chemistry, so you can be able to memorize them and you can come back to this lecture and then go through it. So in Alright, my name is Edeh Chibuzor, and here at Academy X again, we are here bringing you a tutorial video for PCH 331, and today we're going to be looking at organic synthesis of selected drugs as captured in the curriculum of the Doctor of Pharmacy we have in the Faculty of Pharmaceutical Sciences. Alright, so the selected drugs for this particular tutorial as seen here are benzocaine, sulfanilamide, and acetyl salicylic acid. These are the drugs we are going to be looking at today. Alright, so we're going to be beginning with benzocaine, but I would like to let you know that benzocaine happens to be an anesthetic. It's an anesthetic agent. So, and I'm going to be explaining what that means as we begin to break it down. And then, so for sulfanilamide is an antibacterial agent. Sulfanilamide is an antibacterial agent. Alright, and then the acetyl salicylic acid happens to be the drug that is popularly known as aspirin. The drug that is popularly known as aspirin, and it is an analgesic. It is an analgesic. So yeah, what is anesthetics? Anesthetics refers to substances that reversibly cause the loss of sensation along the axon of the neuron. So the loss of sensation that is being instituted or initiated by reason of anesthetics will make an individual not to feel any form of pain or any form of reaction in that region where the anesthetics is operational, depending on the class of the anesthetics. So when we talk about antibacterial agents for sulfanilamide, we are talking about agents that combat bacteria. So, and then when we talk about analgesic, we're talking about agents that help to handle pain. Analgesic simply refers to an agent that, you know, is used to reduce pain or prevent pain, or, you know, give some level of immunity against pain in the body. So these agents, the uses as anesthetics, antibacterial agents, analgesic. In this particular tutorial, we're just going to do a brief overview of their uses, because you will get more details in your pharmacology, and you also get more details as you go further in pharmaceutical chemistry. There are courses that talk more details or give more details about these uses of this medication. So but our focus for today is going to be on the organic synthesis of these particular agents that have been selected so far. So let's run a brief overview for benzocaine as our first agent or our first drug for today. So the classes of anesthetics, like I mentioned, we have two classes of anesthetics. We have local anesthetics and we have general anesthetics. So what are local anesthetics? Local anesthetics are anesthetics that work at specific points in the body. Local anesthetics are anesthetics that work at specific points. They work at specific points in the body. And then general anesthetics work all over the body. So local anesthetics, the word local tells you it's at specific points, while general anesthetics tells you that it's all over the body. So that is basically it. So but there's something I need to point out to you about anesthetics. The word reversibly simply lets you know that anesthetics are not permanent. The actions of anesthetics are not permanent. They are actually reversible, so the person can, you know, regain consciousness after whatever procedure that is being employed for is done. So, and it will interest you to know that benzocaine is an example of a local anesthetic agent. It's an example of a local anesthetic agent. Usually they use it to treat pains or, you know, offer anesthesia for topical regions used externally most of the time. So you can actually get details in your pharmacology and as you go further as a pharmacy student. So local anesthetic agents are divided into basically many of the materials you find two classes. But there's a third class we're including here. The reason we're adding the third class is because there are some local anesthetic agents you cannot classify into the major two classes. So the major two classes we have is type 1 and type 2, but I told you we are including a third class because there are some local anesthetic agents that you cannot capture within type 1 and type 2. So let's come over to type 1. So what are type 1 local anesthetics? They are called the ester groups of anesthetics. So the reason is because they contain the ester functional group. Example of such anesthetics is cocaine, benzocaine, and procaine. And you know we're talking about benzocaine today. So benzocaine is type 1, the ester local anesthetic. So what's an ester? What we have here is the structure of an ester. An ester happens to be a functional group that is gotten by the replacement of the hydrogen of an acidic compound by an alkyl group or an organic molecule. So what we have here, ordinarily, when you see this in chemistry, COOH is the carboxylic acid functional group. So when the hydrogen of the hydroxy group, let me give more details so that you can be able to understand that basically. So we're going to do this. So this is that COOH. Now I want to draw it like much more elaborately. So COOH, we have O and then we have OH. So this is an hydroxy group in the acid. So when the hydrogen of the hydroxy group is now replaced by an organic molecule, maybe an alkyl functional group, we now have what we have there is now an ester. So you see that the hydrogen here have been replaced with an alkyl functional group. So this structure, any structure that features something like this, is referred to as an ester. So that is what we have for type 1. So then for type 2, they contain the amide functional group. They contain the amide functional group. Amide functional group is formed when you do an attachment of amine group to carbonyl group. So these are basic things that you should already have known prior to this time. Just in case you don't have so much idea about functional groups, I would recommend that you look up tables that shows the different functional group you have in the pharmaceutical chemistry, so you can be able to memorize them and you can come back to this lecture and then go through it. So in pharmaceutical chemistry, when we have a group that has a carbon that is double bonded to oxygen, what we call this kind of group, this is a carbonyl group. This is a carbonyl group. So when you have one of the bonds for the carbonyl group being replaced by an amine, so this is an amine. It can be primary, it can be secondary, it can be tertiary. It can be primary depending on how many hydrogen, secondary, and then tertiary. So when you have an amine group being added to a carbonyl group, what you have is an amide functional group. So these are the same thing. So what you have is an amide functional group. An example of such, we have lindocaine, we have dibocaine, we have ibuprofen, we have ibuprofen. There are a lot of them that you can find online. All right, so then the type 3, they are the ones that are neither type 1 nor type 2. They are not ester, they are not amide, so they are miscellaneous. So an example we have there is chlorbutanol. Chlorbutanol happens to be an alcohol, and yeah, you can always look up the structure. So then we'll now go over to the main structure of benzocaine, which we have found out to be a local anesthetic agent and fall under the type 1. So the structure of benzocaine. So what we have here is the structure of benzocaine. So what can you see from this structure? So we're going to be breaking it down, yes, so that you can follow the drawing. So what we have, first of all, we have the benzene ring. We have the benzene ring. So prior to this time, you should have been doing benzene in this particular course. So the benzene ring, yeah, you have your pi bonds that are delocalized. They can always change their directions, unlike the sigma bonds that are fixed. So the pi bonds can always delocalize. Some other persons, when they draw their benzene ring, you have them do a circle because it can always rotate. So in addition to the benzene ring, we have an amine group. So this is an amine group, this is an amine group we're having here. This is an amine group we're having in this particular structure. So basic common name for this, you most likely call it aniline. Yeah, you most likely call this aniline, or you can call it aminobenzene. So you can call it aminobenzene. So but aniline is the common name. Then another thing again you have there is the ethyl ester. ethyl ester. Remember what we said about ester? So we have COO and then we have an alkyl group. So we have the COO and then the alkyl group we have here is C2H5. From our basic chemistry, we know that if when you have C2H5, C2H5 refers to ethyl. It has 2 carbon and then 5 hydrogen, showing that it is connected by one there's connected by one bond. There's no double bond, there's no triple bond, so it's fully saturated. So this is an ethyl group, so we call it an ethyl ester. I hope that makes sense to you. So this is like the functional group, so we can say alkyl ester or just call it ester. So this is ethyl ester because of the kind of alkyl group we have attached to the ester formation we have here. So this is what we refer to as benzocaine. So benzocaine is an ethyl ester of para-amino benzoic acid. Now let me draw para-amino benzoic acid. So I'm going to draw the benzene ring again. Yes, and this is the benzene ring. And in the benzene ring, when you have 2 substituents on the benzene ring, their relationship can either be ortho, it can be meta, or it can be para. For example, if I have a substituent here, say X, and then I have another substituent here, this substituent is ortho to X. If I have another one here, this substituent is meta to X, and if I have another one here, this substituent is para to X. In the same vein, this is ortho to S, this is meta to X, and this remains para to X. So that is basically what we mean by para, meta, and ortho. Details are already being captured in other videos you are watching in this course, but I had to just draw your attention to it so that you can be able to grasp or gain full understanding of what we're looking at today. So if what we call benzocaine, we say benzocaine is an ethyl ester of para-amino benzoic acid. So let us draw para-amino benzoic acid and show how ethyl ester of it is what we refer to as benzocaine. So when you para-amino benzoic acid, so the base compound we have there, the base organic molecule we have there is benzoic acid. What is the structure of benzoic acid? Benzoic acid is a benzene ring that has a carboxylic acid functional group. So what we have there is a carboxylic acid functional group. So this is a benzoic acid. So the word para-amino tells you that an amine group is found at a para position to the benzoic acid. So this is the benzoic acid, this is ortho, this is meta, and this is para. So what we have here is an amine group. So this is para-amino benzoic acid, also called for short PAPA. So para-amino benzoic acid. So what is benzocaine? An ethyl ester of this. The reason is because remember the hydrogen of the hydroxyl group in the carboxylic acid has been replaced by an ethyl functional group. So the moment it was replaced by an ethyl functional group, it automatically changed from PABA into benzocaine. So this is the basic structure of benzocaine. So according to the International Union for Pure and Applied Chemistry, the name that was suggested for this particular compound is ethyl 4-amino benzoate, or you can also call it ethyl para. P is para, para-amino benzoate. So what does that simply mean? Because if you are going to be counting, you most likely have to count from the basal, attachments or substitution we have on the benzene. So this is position 1, 2, 3, and 4. So when we say ethyl 4-amino benzoate, because without the hydrogen, this is going to be a benzoate. Yeah, so this is going to be a benzoate. So the moment the hydrogen was replaced by the ethyl, so you now have ethyl 4-amino benzoate, or you can call it ethyl para, because on the para position, amino benzoate. So we're not going to be going into the 4 steps that are necessary for the synthesis of benzocaine organically. Let's make progress.